As we talk about innovation and moving the needle forward, I think we constantly have to remember that we can't just talk to each other all the time. That groups like this bring the great intellects together, the great thinkers, the people who don't mind moving the needle, and frankly, sometimes being part of a whole paradigm shift. But we have to remember that there's an entire American populace that we have to take with us on this journey. Politics is going to be part of what we talk about today and tomorrow. It just will permeate some of our conversations. But I've been very vocal on the air that while we talk about technology, I think there's this moment in history where we have to combine the power of touch in being human beings and caring about each other and having grace, and the importance of physicians, nurses, social workers sitting at a patient's bedside, with the technology that is frankly so extraordinary and is hurling us forward. And as someone who watches technology go in one direction and sometimes humanity play catch up, or sometimes go in opposite direction, I think one of the extraordinary things about people meeting in forums like this is that we have a chance to marry the two. I've been a very sort of vocal critic of the White House as we've talked about healthcare reform, because I think one of the things we haven't said to the American public is that everybody has to have some chit in this. Everybody has to have some skin in the game. And that technology is only as good as how we combine it with humanity. I'm not a big believer in the worried well being able to get every test, because we will all find something, and then we expect someone else to pick up the tab. I am a huge believer in technology transforming the human condition. And so whether that means that, of course, because I have my GE hat on now, not talking about big MRIs and big ultrasound machines, but handheld portable devices that we can take to towns, villages in rural India or Africa. We have to remember, too, that roads and water are as much healthcare as technology. And when I was with Johnson & Johnson, I got a chance to see the stack of antiretrovirals was sometimes at someone's bedside, but they were useless because nobody had access to good water. So as we talk about technology and extraordinary models like this hospital, where basically you have a clean slate and you get to create something from scratch, which just doesn't happen very often. The challenge, I think, is to remember that technology and humanity and those of us who bridge those gaps have an extraordinary responsibility, and frankly, it's big fun. It's really big fun to be part of the solution. If we're talking about the things that are facing American healthcare right now, we all know that obesity is the #1 thing that's going to break the bank. If 67% of Americans are overweight or obese, we may not be able to play catch up with the aging population with regard to diabetes, stroke, and heart disease that's already in place. But I would argue that because this is a children's hospital, we have an extraordinary moral and ethical reason to make sure that our children and our children's children don't follow in the same footsteps. And sometimes that's beyond imaging. It means figuring out the smart home and making sure that pantries and houses are filled with good things to eat. It also means that as we talk about technology, we don't forget that supermarkets and sidewalks are as important to people's health as the ability to scan. So tonight, I'm going to introduce you to frankly, three extraordinary men, but you're only going to get a snippet from one of them, Senator Daschle. But I get a chance to talk, going to hear from Jan DeWitt, who is my colleague at General Electric, and an old friend of mine who's now the CEO at Johnson & Johnson. And we're going to talk about, frankly, technology and some of the challenges, and you'll have a chance to talk with Alex and ask your questions. So start thinking about the things that are troubling you right now. So you can fire Alex with all the hard questions. I promised I wouldn't ask him tonight because I'd be a really good girl. But I want to leave you with this. I think it's because my parents are now 86 and 90, and because I went through a near-death experience with my father, and I was able and I haven't done this in a long time, to experience health care as a recipient. Every young physician should have something happen to him or her in their 30s so that they understand the lack of humanity in a crisis. But when you are the caregiver or the pit bull or the assigned person, the designated person in your family to take care of an elderly person, you recognize that sometimes the system, as well as you know it, doesn't treat people particularly well. And when my father, short story, because Medicare didn't pay for his shingles vaccine, he thought that was anti-American, so he didn't get his shot. My mother, being smarter than my father, well, he's the surgeon, did get her shot. She's fine, he got shingles. So to watch the medical system in all its glory was impressive. To see the sort of lack of being in the moment, people afraid to touch each other, this separation of latex, which I really do believe is a metaphor for the barriers in medicine, it was jaw-dropping to me to realize that none of us can afford to be sick today without having an advocate there. So as we absorb the information we're going to from tonight's speakers and tomorrow, I would just like to leave it with this audience. The technology and the innovation should be encouraged, invested in, pushed, integrated, and frankly, since I do think this is the most innovative country in the world, start here and remember that we are global citizens. But we cannot afford to divorce human touch and human kindness and human grace from the technology. And I hope that's a theme of tonight and tomorrow.